Well, joining us up first, we are talking about stroke awareness, and we are joined with Anissa Garza, who is a stroke coordinator, and we have Dr. Patrick Noonan, who is the medical director of the Advanced Comprehensive Stroke Center at DHR. So thank you both so much for coming in today.
Thank you for having us.
Thank you. So before we get into, really diving into stroke awareness and the signs of what to look out for, let's talk a little bit about what exactly a stroke does and how that kind of affects the body, or when it actually happens to someone.
Well, there are different kinds of stroke, so we'll start with the two basic kinds. One is called an ischemic stroke, which occurs when there isn't enough blood carrying oxygen and nutrients to the brain. That can be caused by a clot, say a clot arising in the heart from a disease called atrial fibrillation, which is very common and often unrecognized until the patient has a stroke. That clot leaves the heart, travels up aorta into a major artery of the brain, and then lodges in a vessel in the brain, and then the symptoms occur rather suddenly usually. So that's one kind. It's a very common kind of stroke. The other kind is a hemorrhagic stroke, where a bleed occurs in the brain. That may be as a result of hypertension, high blood pressure, small arteries in the center of the brain rupture, causing a hemorrhage, a hematoma, mass of blood in the brain. And the other kind that's very common, it's a little bit less common than that, would be an aneurysm rupture. Many people have heard of aneurysm ruptures. Perhaps even those watching have family members whose aneurysm has ruptured. Some of those patients have done well, and then many have died. So many people can tell you stories of I have a relative who died from an aneurysm rupture, for example.
And what are some of the causes of strokes that you did mention? What can kind of cause it? Is something just, it happens by chance? Is it the lifestyle that they lead? Well,
those are all good questions, and yes, there's truth to all of those statements. The lifestyle. So if you smoke, and perhaps you're a female, but perhaps you have a high blood pressure, you may be, and you have diabetes, you have all the risk factors of cardiovascular disease, you may have more likely to have a stroke than other people. So diabetes, smoking, high cholesterol, high blood pressure, those are all risk factors. Female sex, for some things such as aneurysm rupture. So there's many things you can change. You can change smoking, you can treat your high blood pressure, you can treat your diabetes. You can't change your sex, but you can do a lot of things to prevent strokes.
Right, definitely. And why is it so important to kind of do this and really raise awareness about strokes and kind of the warning signs or the aftercare, I guess, to kind of maybe?
It's all about better outcomes. So when folks have strokes, and folks will continue to have strokes despite what we do and despite who we are and what our nature is, there will be people among us who continue to have strokes or who will have strokes. Perhaps I'll have a stroke, maybe even you or your family members. So once you have the stroke, it's important to recognize it quickly, get to the correct place so it can be treated in order to have a better outcome.
Definitely.
It's all about that.
Definitely. And I know that there is something to help remember those warning signs. I know there's an easy kind of phrase, be fast, I believe. Can we kind of break it down to exactly what those are to kind of look out for?
Sure. So the great thing that the American Heart and Stroke Association has come up with is an acronym to remember the signs and symptoms of stroke. So be fast is something that we have been promoting out in the community the past several months now. And so when it comes to be fast, it's actually very, very simple acronym to remember. So the B is going to stand for balance or coordination. So someone can get up and sometimes they may be leaning over to one side, they may not keep their balance. E is going to stand for eyes. So any sudden vision loss or any sudden vision changes without a known cause may be a sign or symptom of a stroke. And those signs and symptoms will catch more of the posterior stroke symptoms that are sometimes a lot harder to miss on any kind of scan in the hospital. F is going to stand for face, so they could have asymmetry of the face. When they smile, they may not be able to have an even smile. A stands for arms, or arm extremity weakness. So if there is any weakness on one of the extremities, we know that that may be a sign or symptom of stroke. S stands for speech, so we can listen for slurred speech, any trouble speaking or understanding. They may not be able to comprehend a simple phrase or even say a simple phrase back to you. And T, of course, is time. So time is of the essence when it comes to stroke. the number one thing that we have to let people know is that time is the most important thing for having a better outcome. So calling 911 is going to be the most important thing. We have to be fast when it comes to stroke. So of course, calling 911, reporting to the EMS providers when that person was last seen at their baseline, when they were last seen normal, and that's going to let us know, you know, what kind of treatment options are available for that patient.
Definitely. And is there anything else that someone at home can do if they do notice any of these warning signs, aside from the most important, of course, calling 911, taking them to see a medical professional immediately? Is there anything else that they can do at home to help in any way?
When it comes to stroke, the most important thing to do is to call 911. If they're suspecting that it might be a stroke, something that's totally outside of their baseline, the most important thing is to call 911. We obviously don't want to delay any kind of treatment options that there are for the patient. Sometimes people can wait too long, and then at that point, there's really nothing else that we are able to do. So it's important that we are able to consider the time factor when we are thinking that it might be one of these signs or symptoms for stroke.
Definitely. And are strokes something that I think are rising in the community, or is it something that kind of we just want to get out the awareness in general to them, or is it something that you've noticed needs to be talked about because folks aren't aware exactly of what's going on or how to kind of treat it?
I think it always needs to be talked about. It said there are about 750 or more thousand people per year in the United States who have strokes. The exact number is really unknown, but that's a number that's often cited. And patients don't read those numbers. They don't read the articles. So they need to really understand that getting to the hospital quickly is the most important thing. Many patients will still arrive by car, brought in by their family members. That is not really the best thing for them, but sometimes it's the only thing they can do.
Of course. Yeah, definitely. So I think it's important to kind of do these sorts of things and to be educated and to educate the community as well on especially this acronym that's so easy and helpful to kind of remember and to kind of keep those, you know, handy.
There's one thing I'd like to add. Earlier question, what can people do? CPR is something that anybody can learn. And many people do not know how to perform it. Cardiovascular disease includes cerebrovascular disease and strokes. So many times patients who have strokes have also cardiovascular disease. If anyone in their household takes a CPR course, they are now attuned to medical problems. So I think I'm going to recommend that. Any household should have members who know how to perform CPR. Because in addition to recognize the signs of stroke, you have to be sure that patient is actually breathing, has a pulse, is awake. You know, they're common things, very basic things that need to be done.
Definitely, and of course, knowing CPR could be, you know, the matter between life or death. So I think you're right. It is something that most households, someone in them should know how to perform it. So I think it is a good recommendation, of course. But I want to thank you both so much for coming in today and kind of talking to us a little bit about this awareness, or bringing awareness really to strokes and to kind of the warning signs, to really educate our families here in the Rio Grande Valley to kind of make sure to have them know what to look out for. So again, I want to thank you guys so much for coming in this morning.